I spent the first really 90 days just taking it all in and learning what the culture was like and learning what the issues had been, hearing from both the doctors and the staff here about what the history of the partnership and the health system had been. Because keep in mind, I was a Tulane student in the 80s before the partnership between HCA and Tulane. And so the Tulane that I knew is different than the Tulane that we have today. I developed sort of a key list of priorities, and the first priority was getting the right leadership team in place for me, because there were a number of things I wanted to capitalize on in terms of Tulane's rich tradition and history, but there were also some new directions that I wanted to go on based in the experience I've had at other academic medical centers, and I've been lucky enough to be at some really good ones, and really felt like we could help serve the medical school by doing some of the things that the other academic centers are doing. As of today, the person who remains on our leadership team that's been here a long time is Todd Lacaz, our Chief Financial Officer, who's just a great asset for Tulane and for me personally. Everyone else has been changed out. Everyone else is a new teammate, which is both a challenge because they don't know a lot about the history of Tulane and the partnership, but I also see it as an opportunity that I think it's good that they're not coming with any baggage or predetermined beliefs about what should happen. My Chief Nursing Officer, I am now in a transition because Danita Sullivan's taken another job with HCA, so I've now got another friend of mine serving as a Executive Vice President for Nursing. That's Jan Feldman. And Jan has only been at academic medical centers in her career. So she's now helping us here and really, I think, going to help us transform nursing for Tulane and for the community. I think nursing at Tulane will end up making a big impact on this community. The neat thing about Tulane from a nursing perspective, all the nurses in the city love coming to Tulane to rotate as part of their education because we have such great doctors. There's a lot of complex cases that are done here, so they feel like this is just a rich educational environment for them to do their clinicals. And then another subset of them want to come work here after they finish nursing school, which is great for us. Some of them want to stay. They love this academic environment and they can't imagine being anywhere else. But what Jan is going to bring to us is that she's taking us along a pathway to excellence, which is a very defined set of principles and guidelines set out by the nursing professional societies, which really elevate the profession. And if I could really sum it up in one sentence, it would be that nurses are best at practicing like all healthcare providers are at the top of their license. And so how do we redesign our systems so that the nurse is doing things that you and I want a nurse to do for us? So should the nurse be emptying the trash can, or should the nurse be helping to serve meals? And they do all those things. That's the great thing about Tulane Nursing. They'll take care of anything you ask them to do. They'll get it done for the patient. But I think what you really want them doing is assessing the patient's vital signs, assessing their response to medications, making sure they're getting the right medications, checking for side effects, all of those things that involve the clinical discipline for any chief executive officer sitting down with the patients and listening to how they're being treated in your hospital is something just of incredible importance. And I always try and see it from their side. And you might think that because I go in and give them my card, they're going to tell me all the rosy things, but I hear all of it. I hear a lot of compliments. That's primarily what I hear. But I also hear ways that we've let people down. And what my constant charge to myself and my team is how can we be our best for the next patient that walks in the door? And so if we do have places where we've let someone down, I'm after fixing a process, not just doing service recovery on that patient, but how can we prevent that from happening to the next patient that walks in the door? Probably the number one priority for us is that we've set a Moonshot goal, we're calling it, to be recognized as a top academic health system by the year 2025. So we've kind of given ourselves 10 years to do that. And so having a very specific plan in place that is able to show our board and our medical staff and our employees, here are the stages of the Moonshot Plan that are going to get us to where we need to go. Just like one of the Apollo rockets had stages in it and the journey was planned out well, we need to be doing the same thing. So our charge for ourselves this year, we're calling it laying the foundation. So just like the moonshot analogy has the before you build the rocket, you've got to have the rocket pad, and you've got to have Cape Canaveral, and so that's what we're doing this year. At the end of this year, we're going to be able to outline the different stages of how we get there. The key thing is we need to be able to show our board and our medical staff and our people that we've got a path that will get us there, and give them some confidence that it's going to happen. And that's what I feel all around the campus is I feel two things. I feel people are glad to know what the vision is, and they're excited about that. It's something they buy into. And the second feeling that I have is one of confidence that they figure, you know what, we can do this together. Yeah, it's going to be hard, but this is something we're excited about and we think we can do it. And, you know, only confident people win.